The National Center for Health Statistics lists the leading causes of death in the United States. As we would expect, heart disease ranks number one, followed by cancer and COVID-19, then accidents, stroke, lung disease, and Alzheimer's. Diabetes ranks number 8 on the list, followed by influenza and pneumonia, and then nephritis and nephrosis, both of which are descriptions of chronic kidney disease. We hear a lot about heart disease and diabetes, but what we're not usually told is that chronic kidney disease, usually referred to as CKD, is a primary factor that any person who suffers from a cardiovascular problem or who has diabetes type 2 should be aware of. High blood pressure can trigger a stroke and is often mentioned as a possible link to CKD, especially since the AMA lowered the normal reading to 120/80. Research from various sources do have some contraindications to this, however. There are controversial studies that do not connect high blood pressure to kidney disease, especially if the reading is 140/80, which has been the normal for many years. The point is, every cell and organ of our body are connected, and since we're all unique individuals, what affects one person may not affect another, or may affect them in a totally different way. And that affects the results of the research projects. There are at least 37 million Americans that suffer from CKD. According to the latest report from the National Center for Health Statistics in 2021, many do not even know they have the disease, even when it's severe. If one or more of the associated diseases is present, that disease becomes the focus, and CKD is rarely even considered unless blood and urine tests trigger an indication of that problem. The symptoms of CKD are very similar to any number of other conditions that are more well known. CKD is usually accompanied by, or maybe caused by, diabetes, heart disease, and possibly hypertension. The biggest problem for those who have CKD is that much of the medication given for those linked diseases have an adverse effect and can cause more damage and faster progression of the kidney deterioration. It is unusual that someone with CKD does not have one or more of the named associated diseases. CKD does not have a specific cause, and some researchers have concluded it can be caused by one of those conditions. And other researchers say CKD is the cause of an associated condition. The fact is, nobody really knows. There's no known prevention, treatment, or precise way to manage the disease, and no cure or way to reverse it. Eventually, it may escalate to what is called end-stage renal disease, or ESRD, which means the kidneys simply stop functioning altogether. The only option for continuation of life in that case is either dialysis on a regular basis or a kidney transplant. Transplants are subject to rejection, and of course, the infection is always an issue. But if the kidneys shut down, those are the only two ways to avoid termination of life. People have lived many years with either option, and there's no particular life expectancy data on either dialysis or kidney transplants, although there may be rejection of the new kidney requiring a retransplant. This usually happens within the first few months, but the percentage is low. Survival rate is up to 10 years or more for over 80%. Researchers claim that the kidney transplants are always the better choice if the patient is in a stable enough health condition to undergo the operation. The right to choose whether to have the transplant is, of course, always up to the patient. Now, there are ways to slow down or even avoid progression if you have CKD. Ideally, prevention of the associated diseases would be the best solution. How do you do that? Well, one way is to be a self-advocate, where the doctor prescribes medication for one of the linked diseases or for any other medical problem you may have. High blood pressure meds are famous for causing kidney damage, but many people are taking 2 or more. I know one woman who's on 4. One of the main side effects of almost every blood pressure medication is possible kidney damage. Unfortunately, not every doctor knows the side effects or contraindications of the medicine they're prescribing. I recommend that you read the printed information that by law has to come with your prescription. It will tell you the known side effects or contraindications. Or you can research on the internet, which is probably more up to date. There are benefits to modern medicine, but every drug has side effects, and I prefer to substitute natural or holistic treatments when possible. Your doctor also needs to know what supplements or vitamins you're taking, because your prescription drugs may interfere with the combination of the drugs may cause a problem. As I said, be your own advocate so you can have a meaningful conversation with your physician about your treatment. Be more diligent if you have prescriptions from more than one doctor, and do not hesitate to share that information with all of them. I highly recommend choosing a doctor who's also a DO, which is a doctor of osteopathic medicine. They have extended training in more natural and holistic fields, and they will be more open to other options you may want to choose. My interest in this subject is not professional, but personal. I have chronic kidney disease and have been able to keep my CKD at a stable level for well over 10 years without prescription drugs. I've also avoided heart disease, diabetes, and blood pressure, which are usually associated with CKD, thanks to my research and the fact that I'm on no prescription medication. Knowledge is power, and the research I've done and am still doing is valuable information for my own health. Sharing with others, like you, may help them be aware of how other diseases are associated with hidden kidney deterioration. Kidney disease is not a death sentence, but more of a life sentence that involves research, attention to diet and lifestyle, and listening to your own body. Thank you.